Well, hey, so I have been at the pulmonologist, and I know that some people get real nervous when they're going to go to the doctor, especially a doctor they've never been to, and I've never been to a pulmonologist in my life. Well, I did not Google what happens at a pulmonologist because I didn't know what they were going to do specifically, and I didn't want to see something that was going to get me all, afraid and nervous and panicky and stuff, because I'm very attached to my ability to breathe. So I figured, whatever they're going to do, right? And like I always say, you just have to deal with whatever you're confronted with, right? So, just getting in my car after my visit. So I went, and I'm going to post a few pictures. It was fine. Everything was really quick. Oh, and also, these days they try to make medical tests patient-friendly as much as they can. They really do. For example, in this test, she explained everything to me before she did it, and there's this booth that I was in. You'll see a picture of it. Kind of like a small shower booth, rounded, and the round glass door so you can see out and everything. And there is a panic button. It says door release switch because, some people panic when they're in a small space, even though you could see out, you could breathe. But, and I used to be one of those kind of people, but I have worked through that for the most part, I think. I'm not going to say for sure totally because I don't know, if I was down in some totally dark, closed-in place and couldn't get out, I might panic for a bit there. But this was fine. So, they have a button where you can open that door if you start to panic. And also, you have a thing in your mouth that you breathe in and out of. But if, that bothers you, take your mouth off of it. Nothing, is attached to where you have no choice. Compare this to, okay, I'm 68, all right? When I was a child, if you went to the doctor or the hospital, whatever they were going to do, they were going to do. And you just had to go through with it. And things were not patient-friendly back then. They didn't coddle children or give them, pretty sheets or colored blankets or little, I took a breathing treatment today. My granddaughter uses breathing treatment. She has a little fishy or dragon face thing that she holds over her nose. Now for an adult, I just had a plain thing, but didn't look special or colorful. But, today, medicine is also concerned with the health of our minds. And now, like with the pulmonologist, when I was sitting in that booth, this is a good example. If you get nervous, think about this. Is it going to be productive? Is it going to help the doctor if you have a panic attack? Or if you just get so nervous that you hyperventilate and you pass out and you fall out of the booth and you knock your head and you get a concussion? They need for you to be nice and calm and comfortable to do the tests properly. So they try to make things more for your comfort because it's not going to help you and it's not going to help them if you're like, right? So if you have to go to the doctor and you're nervous about it, you can always ask, what's going to happen? Can you please tell me beforehand? But also, and you can ask, how long is it going to take? Because some of us feel like, well, okay, I can put up with anything for a short amount of time. But do what you need to do. If you have to go to the doctor, please don't put it off. It's better to go, find out what's going on with you, and take care of it than it is to always have in the back of your mind, oh no, what are these symptoms I've been having? What could be wrong? Okay? So buck up, you can do it.